As a neurologist, I need you to understand something that could save your life. Stroke is not always a sudden event that strikes without warning. In many cases, your brain and body send signals days before the attack occurs. Sadly, too many people dismiss these early signs as fatigue, aging, or minor health issues, only to find themselves facing permanent disability or even death. Every few minutes, a life is lost to stroke, making it one of the leading causes of death worldwide. But what most people do not realize is that the tragedy could often be prevented if the warning signs were recognized in time. In the days or even a week before a major stroke, the brain may give you subtle yet dangerous alerts. Numbness in one side of the body, a sudden vision problems, unexplained dizziness, or difficulty speaking may appear briefly and then fade away. These are not random episodes. They are cries for help from a brain that is not getting the oxygen and nutrients it needs. Ignoring them allows damage to spread silently until the final, devastating event occurs. The hopeful truth is that recognizing these early signs gives you the power to act. With immediate medical attention, treatment can begin before permanent harm is done. In this video, I will share with you 9 early warning signs that can appear days before a stroke, along with the steps you must take if you notice them. Before we continue, I want to hear from you. Have you or someone you love ever experienced sudden dizziness, numbness, or speech problems that disappeared quickly? Share your experience in the comments, because your story may help someone else recognize the danger and seek help before it is too late. 1. Numbness or weakness on one side of the body. One of the clearest early signs that a stroke may be approaching is sudden numbness or weakness affecting one side of the body. It may involve the arm, the leg, or the face. And often it feels like the body is no longer obeying commands. A person may notice that one arm feels heavy when trying to lift it, or that one leg drags while walking. The smile may suddenly appear uneven because one side of the face droops. These changes may seem minor at first, and they may even disappear after a few minutes. But they should never be ignored. They signal that a part of the brain is not receiving enough blood flow and oxygen. What is happening inside the body is often a brief interruption of circulation, sometimes caused by a small clot that temporarily blocks a vessel. Doctors call this a transient ischemic attack, or a mini stroke. Although the symptoms resolve quickly, the danger is far from over. In fact, many patients who suffer a mini stroke go on to experience a major stroke within days or weeks if no treatment is given. Think of it as a rehearsal for the real event, a chance for the brain to warn you before irreversible damage occurs. The danger lies in how easy it is to dismiss these symptoms. People often blame fatigue, stress, or even a poor night of sleep. They wait to see if it improves. And when it does, they move on with life as if nothing happened. But during that time, blood vessels remain fragile. Clots may still form, and the brain continues to live on the edge of catastrophe. That is why immediate medical evaluation is essential. Even if the weakness lasts only a few minutes, it demands urgent attention. Doctors can perform scans to detect blockages, prescribe medications to reduce clot formation, and manage blood pressure or cholesterol levels that silently feed the problem. Lifestyle changes, such as adjusting diet, increasing physical activity, and quitting smoking, may also be recommended to strengthen vessel health. The earlier these steps are taken, the greater the chance of preventing a full stroke. Imagine waking up one morning unable to move one side of your body. unable to lift an arm or speak clearly. For many, this is the reality when the warning signs are ignored. But by recognizing numbness or weakness on one side, and by seeking help immediately, you give yourself a second chance. Remember, the brain controls every thought, every movement, and every memory. Protecting it requires vigilance. If you or someone you love experiences this symptom, even briefly, treat it as a medical emergency. Call for help right away. Do not wait for it to pass, because the next episode may not end so quickly. Every minute matters, and quick action can mean the difference between recovery and a lifetime of disability. 2. Sudden vision problems or dizziness. Another important warning sign that a stroke could be approaching is a sudden change in vision or unexpected dizziness. The eyes are directly connected to the brain through delicate pathways, and when blood flow to these regions is reduced, the result can be blurred sight, double vision, or even sudden blindness in one or both eyes. These episodes may last only a few minutes, and people often convince themselves that it was fatigue, eye strain, or just a passing problem. But in reality, they can represent a critical reduction of oxygen to the parts of the brain responsible for vision. Ignoring these changes allows silent damage to continue, pushing you closer to a devastating event. Dizziness and loss of balance are equally dangerous. If you suddenly feel as though the ground is shifting, if you stumble while walking, or if you cannot coordinate your movements, it may not be simple clumsiness. The brain has specific regions that control balance and coordination. When these areas receive less blood, they respond by sending confused signals, leaving you unsteady. These episodes can appear days before a major stroke, especially in the form of a transient ischemic attack. They may fade quickly, but that does not make them harmless. The danger is that many older adults dismiss dizziness as a normal part of aging or low blood sugar, and they do not seek medical care. But stroke does not wait for a convenient time. When blood supply is compromised, brain cells begin to die within minutes. A temporary loss of sight or sudden dizziness is a cry for help that should never be ignored. If you or someone you know experiences these symptoms, the safest action is to seek immediate medical attention. Doctors can run imaging tests, evaluate blood flow, and begin preventive treatments before the condition escalates. Simple measures such as controlling blood pressure, adjusting medications, and improving circulation can dramatically reduce the risk of a full stroke. Remember, the brain does not send these signals by accident. Sudden vision loss or unexplained dizziness is a clear warning that something serious is happening. Treat it as an emergency, because the next episode may not give you the chance to recover. Acting quickly can preserve your independence, your memory, and your life. 3. Severe headache without clear cause. A sudden, intense headache that seems to come out of nowhere is another critical warning sign that a stroke may be approaching. Unlike ordinary headaches that gradually build or respond to rest and medication, this type of pain often arrives abruptly, with a sharp and overwhelming intensity. Many patients describe it as the worst headache of their life, spreading across the head and sometimes radiating to the neck or behind the eyes. What makes this symptom particularly alarming is that it may signal bleeding within the brain or severe pressure caused by restricted blood flow. Headaches are common in everyday life, often linked to stress, dehydration, or lack of sleep, which is why so many people dismiss them. But a headache that strikes suddenly and powerfully, especially if it does not improve with common painkillers, should never be ignored. When blood vessels in the brain are weakened, even a small rupture can cause blood to leak into surrounding tissue. This not only damages brain cells, but also raises pressure inside the skull, triggering severe pain. In some cases, the headache is accompanied by other neurological symptoms such as nausea, vomiting, numbness, blurred vision, or confusion. Together, these signs form a dangerous picture that demands immediate medical attention. The greatest danger lies in waiting. Too many people hope the pain will fade or choose to rest until it passes. But each hour of delay allows the damage to spread, reducing the chances of recovery. If you or someone you love experiences a sudden, unexplained headache that feels unlike any other, the correct response is to treat it as an emergency and seek urgent evaluation. Doctors can perform scans to determine whether there is bleeding or a clot, and swift intervention can prevent a minor episode from escalating into a full stroke. Remember, your brain rarely sends signals this powerful without reason. A severe headache without clear cause is not simply discomfort. It is a potential alarm bell that blood vessels are under strain or have already ruptured. By listening to this signal and responding quickly, you may prevent irreversible damage. Never assume that a new and sudden headache is harmless. Take it seriously. Seek care. And protect your brain before the window of opportunity closes. 4. Speech difficulties and language problems. One of the most recognizable early signs that a stroke may be approaching is sudden difficulty with speech or language. A person may suddenly find it hard to form words. Their speech may sound slurred, or they may be unable to express what they want to say. In other cases, they may not understand what others are saying, even when the words are simple. These episodes often appear suddenly and may disappear within minutes, which leads many people to ignore them. But in reality, they are a powerful warning that the areas of the brain responsible for language are not receiving enough blood flow. The brain has specialized regions, particularly in the left hemisphere, that control speaking, understanding, reading, and writing. When blood supply to these areas is interrupted, the ability to communicate breaks down. This breakdown may look like stuttering, substituting the wrong words, or struggling to follow a basic conversation. Even short episodes of confusion or inability to find the right words should be taken seriously. Doctors often classify these events as transient ischemic attacks, or mini strokes, which indicate that a major stroke could strike soon if no intervention occurs. The danger of ignoring speech difficulties is that they may be dismissed as tiredness, stress, or distraction. Family members may assume the person is simply not paying attention or is having a moment of forgetfulness. But when speech changes appear suddenly and without explanation, they are almost always linked to brain function and should be treated as emergencies. Immediate medical evaluation is essential. In the hospital, imaging tests can determine whether blood flow is blocked and whether medication is needed to dissolve clots or prevent new ones from forming. The faster treatment begins, the greater the chance of protecting brain tissue and preserving communication abilities. If left untreated, these small warnings may escalate into a full stroke that leaves the person permanently unable to speak or understand language. Communication is central to independence and dignity. Losing the ability to express yourself or to understand loved ones is one of the most devastating outcomes of stroke. That is why even a brief episode of slurred words or confusion should never be ignored. Treat speech problems as the brain's urgent call for help. By acting quickly, you protect not only your life but also your ability to connect with others in the most human way. 5. Memory loss and short-term confusion. Another warning sign that a stroke may be approaching is sudden memory loss or unexpected confusion, especially when it affects short-term recall. A person may forget names of familiar people and lose track of recent conversations, or become disoriented about time and place. They may walk into a room and not remember why they went there. Or they may suddenly forget the date or confuse simple tasks that were once routine. While occasional forgetfulness can be a normal part of aging, sudden and repeated episodes of confusion are a red flag that should never be ignored. The reason this happens is that the brain regions responsible for storing and retrieving memory depend on a constant supply of blood and oxygen. When that supply is reduced, even briefly, the ability to recall and process information breaks down. In some cases, these episodes may last only a few minutes, similar to a transient ischemic attack. But they are still a sign that the brain is under stress and at risk of further injury. Families often mistake these moments for distraction, fatigue, or emotional stress, and the person may try to laugh them off. But the danger lies in missing the fact that they represent real dysfunction of the nervous system. When memory lapses and confusion appear suddenly in someone who was otherwise sharp and alert, the brain is sending a strong warning that circulation is compromised. Without intervention, these temporary episodes can quickly progress to permanent damage. Seeking immediate medical care is the only safe choice. Doctors can investigate whether high blood pressure, diabetes, or blocked arteries are contributing to the problem. Brain imaging may reveal early signs of damage, and medications or lifestyle changes can be prescribed to reduce risk. The earlier these steps are taken, the more likely it is to prevent a major stroke. Memory is not just about facts. It is about identity. Losing the ability to remember daily events or recognize familiar places erodes independence and quality of life. By paying attention to sudden confusion or short-term memory loss, you can take action before permanent injury occurs. Treat every lapse that feels unusual or unexplained as an urgent medical issue. Acting quickly not only protects your brain, but also preserves the memories and connections that make life meaningful. 6. Sudden mood or behavior changes. A stroke does not only affect movement, speech, or memory. Sometimes, the earliest warnings appear in the form of sudden mood swings or changes in behavior that seem out of character. A calm person may become irritable or aggressive for no clear reason. Someone usually cheerful may fall into sudden sadness, anxiety, or even depression. These emotional shifts are not just personality quirks or reactions to stress. They may be signs that blood flow to critical areas of the brain is being disrupted. The brain regions that regulate emotions, particularly the frontal lobes and limbic system, rely on a steady supply of oxygen and nutrients. When circulation is reduced, the balance of chemicals that control mood is disturbed. This disruption can appear as irritability, impatience, loss of interest, or sudden episodes of crying or anger. Families often overlook these changes or attribute them to aging, fatigue, or the pressures of daily life. But when such shifts appear abruptly and without obvious cause, they should be considered serious warnings of possible neurological compromise. These emotional changes may also occur alongside other subtle neurological symptoms, such as fatigue, mild confusion, or difficulty concentrating. Together, they form a pattern that should never be ignored. Unfortunately, many people delay seeking care, assuming that mood changes can be managed with rest or reassurance. But if these shifts are linked to reduced blood flow in the brain, ignoring them allows silent damage to progress until a full stroke occurs. If you or a loved one notice sudden emotional instability, the safest step is to seek immediate medical evaluation. Doctors can assess whether cardiovascular risk factors such as high blood pressure, high cholesterol, or diabetes are contributing to the problem. Imaging tests may detect small vessel changes or early signs of reduced blood supply. With timely intervention, treatment can begin to stabilize circulation and prevent a larger, irreversible event. Emotional health is deeply tied to brain function. When mood or behavior changes appear suddenly, they are not only a threat to mental well-being, but also a direct sign that the brain may be under physical stress. Recognizing these changes as potential warning signs of stroke can mean the difference between early intervention and devastating loss. Do not dismiss unexpected shifts in personality or mood. Treat them as the brain's way of calling for help, and respond before the opportunity for prevention is lost. 7. Motor skill problems and loss of coordination. Another early signal that a stroke may be approaching is difficulty performing simple movements or a sudden loss of coordination. A person who has always been able to button a shirt, hold utensils, or write clearly may suddenly struggle with these everyday tasks. Hands may feel clumsy, fingers may not respond with precision, or fine movements may take longer than usual. Alongside these issues, some people experience weakness or heaviness that makes walking or balancing more difficult. These problems may appear briefly and then improve, but they are far from harmless. They often reflect a temporary reduction of blood flow to the areas of the brain that control motor skills. The brain's motor cortex and cerebellum coordinate every action, from lifting a cup of tea to walking across a room. When circulation is disrupted, even for a short time, these regions cannot send proper signals to the muscles. The result is awkward movement, or slowed reaction, or loss of balance. Families may notice that a loved one drops objects more frequently, appears unusually clumsy, or seems unsteady on their feet. It is tempting to explain these changes as fatigue or aging, but sudden onset coordination problems should always raise alarm. One of the most dangerous assumptions is that mild movement issues will resolve on their own. While symptoms may indeed fade after a few minutes, they often represent a transient ischemic attack, the body's way of warning that a major stroke is imminent. Without immediate medical evaluation, the next episode could cause permanent paralysis, robbing the individual of independence. Doctors can use imaging tests to detect blockages or vessel narrowing, and treatment can begin before severe damage occurs. Therapy may include medications to prevent clot formation, control blood pressure, or manage blood sugar and cholesterol. Simple lifestyle adjustments, such as daily physical activity and a balanced diet, also strengthen vessels and improve circulation. Motor skills are the foundation of independence. Losing the ability to dress, eat, or walk without assistance can transform daily life in an instant. By recognizing motor skill problems and loss of coordination as urgent warnings, you gain the chance to protect both function and dignity. Never dismiss these changes as simple clumsiness. Treat them as the brain's call for help. Act quickly and give yourself the best chance of preventing permanent disability. 8. Seizures and abnormal electrical activity. Although less common than other early symptoms, seizures can sometimes be a warning sign that a stroke is near. A seizure occurs when there is a sudden burst of abnormal electrical activity in the brain. This may happen because blood flow to part of the brain is temporarily reduced. starving the cells of oxygen and triggering instability in the nervous system. The episode may look frightening. A person might suddenly lose consciousness, shake uncontrollably, or experience brief periods of staring into space and becoming unresponsive. While seizures are often linked to conditions such as epilepsy, in older adults, they may also signal vascular problems, especially when there is no history of seizures before. The link between seizures and stroke lies in the delicate balance of the brain's electrical system. Neurons communicate with one another through signals powered by oxygen and glucose. When that supply is interrupted by a clot or a leak in a blood vessel, neural misfire, creating uncontrolled electrical surges. This can present as full-body convulsions, sudden jerking of one arm or leg, or subtle lapses in awareness. Even a single seizure in someone with no prior history should raise immediate concern. The danger of ignoring this symptom is severe. A seizure may be the brain's final warning before a major stroke occurs. Without urgent evaluation, the underlying problem, whether it is narrowing arteries, bleeding, or clot formation, can progress until permanent damage is done. Waiting to see if it happens again is a mistake that could cost both independence and life. If a seizure occurs, emergency care should be sought immediately. Doctors will conduct brain imaging and blood tests to determine whether circulation issues are involved. Treatment may include medications to stabilize electrical activity, anticoagulants to reduce clot risk, or surgery, in rare cases, to repair fragile vessels. Addressing the cause early can prevent not only future seizures but also the stroke that may follow. Seizures are dramatic and alarming for both the person and their family. They should never be dismissed as isolated events in older adults without prior history. Instead, they must be treated as a serious neurological red flag. Recognizing them as potential precursors to stroke allows for early intervention, offering the best chance to protect brain health and preserve quality of life. 9. What to do if you notice these warning signs? Recognizing the early signs of stroke is only the first step. What truly saves lives is knowing how to respond when these symptoms appear. Too often, people wait, hoping the problem will fade. Or they try to treat themselves with rest or over-the-counter medication. This delay is dangerous. Stroke is a medical emergency, and every minute without proper treatment means more brain cells are lost. The golden window for intervention is narrow, and quick action can determine whether a person recovers fully or lives with permanent disability. If you notice sudden numbness, slurred speech, vision problems, dizziness, severe headache, confusion, mood changes, loss of coordination, or seizures, the correct response is to call emergency services immediately. Do not attempt to drive yourself or wait to see if symptoms improve, even if the signs last only a few minutes and then disappear. They may represent a transient ischemic attack. This is not harmless. It is a loud warning that a full stroke may follow soon. Treating it as an emergency allows doctors to begin preventive care before irreversible damage occurs. While waiting for medical help, remain calm and reassure the person experiencing symptoms. Avoid giving them food, drink, or medication unless directed by a professional. Pay close attention to their breathing, level of consciousness, and ability to move, if possible. Note the exact time symptoms began, because this information is critical for doctors to decide which treatments are safe and effective. Certain clot-dissolving medications must be given within hours of the first sign to work properly. Once at the hospital, Doctors will use scans and tests to determine whether the stroke is caused by a clot or bleeding. Treatments may include medications to dissolve clots, reduce blood pressure, to stabilize electrical activity, or prevent further damage. For some patients, surgery may be necessary to repair or remove blockages. Early arrival dramatically improves the chances of recovery, which is why speed is so important. The most important thing to remember is that hesitation costs lives. Never ignore or downplay the early warnings. If you or someone close to you experiences these symptoms, act as though every second matters, because it does. By seeking help immediately, you are not only protecting brain function, you are giving yourself the best chance to preserve independence, memory, and quality of life. Quick action turns a potential tragedy into an opportunity for survival and recovery. Doctor's final words. As a neurologist, I want to leave you with a message that could protect both your life and the lives of those you love. Stroke is not always a sudden, unpredictable event. In many cases, the brain whispers warnings days in advance. Numbness on one side of the body, vision problems, sudden dizziness, severe headaches, slurred speech, memory lapses, mood changes, clumsy movements, or even seizures are not minor inconveniences. They are urgent messages that your brain is struggling and that a full stroke may be approaching. Ignoring these signs is like ignoring smoke before a fire. The hopeful truth is that awareness and quick action can prevent disaster. If you recognize any of these symptoms, treat them as an emergency. No matter how brief or subtle they may seem, call for medical help immediately, because minutes truly matter. Early treatment can dissolve clots, stabilize blood flow, and stop permanent damage before it begins. And every time you respond quickly, you give your brain a chance to heal and protect itself. Prevention does not end with emergencies. Protect yourself daily by managing blood pressure, controlling cholesterol and blood sugar, eating nourishing foods, staying active, avoiding smoking and excess alcohol, and keeping up with regular checkups. These steps may sound simple, but together they create a shield that keeps your brain strong for years to come. I also encourage you to talk about these warning signs with your family and friends. The more people who recognize them, the more lives can be saved. Your story or your awareness may give someone else the chance to act in time. Share your thoughts in the comments, especially if you or someone you know has ever experienced sudden dizziness, weakness, or slurred speech. By starting this conversation, you could help prevent a tragedy. Remember, stroke can steal your independence in seconds, but prevention and awareness can preserve your life for decades. Do not wait until it is too late. Take these warnings seriously, act quickly, and protect the brain that carries your memories, your personality, and your future.